Hello.
Just for the people to know you, could you introduce yourself, your name, and what you do?
All right, thank you. My name is Beth Njoroge, and Beth Njoroge is a professional counselor. I'm a marriage and family therapist. I'm also a born-again Christian. I am a mother, and I'm happy to be here.
Thank you.
Thank you.
Welcome to this interview.
Mm-hmm.
So, today we're talking about your perspective on chronic illness people, whether kids, teenagers, adults, even elderly people. So, for the ones who don't know me again, I'm Marvel, and I'm a person dealing with chronic illness, but I'm a survivor. I wanted to ask, so when you get diagnosed chronic illness, does age matter when it comes to such things? Like, the first question, how do a child between 0 to 12 years, how do you help a child who is diagnosed with chronic illness? Let's start from there.
All right, thank you. I would start by saying that that's a very difficult moment for the child who is suffering from this chronic illness or who have a condition, because sometimes they perceive themselves like they have lost a developmental stage. They are also grieving. Sometimes a child will not even understand, why am I not like others? Why am I not allowed to go to pray out there like other children? Or even when I join them, how comes there are some things I'm unable to do? There are some games I cannot be involved through. So yes, we do help children who are between the age of
0 to 12.
0 to 12.
Okay.
And because they may not be able to express themselves like adults, we help them through what we call play and art therapy. Play and art therapy. Yes.
And what about the second batch where we're talking about teens and young adults between the age of 13 to 25? How do you deal with them?
Yes, thank you. Yeah, these are people who are discovering and rediscovering themselves. And most of the time, they are perceived as people who are going through identity crisis.
Yes.
Now, if they are going through identity crisis and they have another health challenge, like the condition, they perceive themselves like differently abled. Now, that even complicates the things that they are going through. So yes, we can help them depending with their age and stage.
And when we come to the adults between 26 to 65, that's a parent or a wife, and all of a sudden the health was good, but then they're at 30, you have 2 kids and a husband, start getting sick. How do you talk to them, make them know that they're not alone? Because that age, they have people who need them, maybe having young kids and a husband. So it's turns their life around, becomes a new thing. So, and I've seen many people, even in my group, that they are mothers, but when they get sick, they can't even be a mother to that child with chronic illness, not because they don't want to, but they're unable to do it even physically. So how do you cope with such people?
And my heart goes out to them because of what they are battling and even because of the transition issue. They have been very much okay. Then at some point in their adulthood, they realize they are unwell. And the news are broken to them that they are not only unwell, but this is a chronic illness. That's a bit hard. And it can really make them become very sad with a lot of anxiety. being very overwhelmed because of issues like of stigma. How am I going to accept this? How am I going to live from now henceforth? What about my children? Who will be taking care of them? A lot of anxiety, a lot of hard issues they are trying to contemplate. But as a counselor, I would love to say that yes, we can be there for them. We can help them to process these issues. We can tell them it is doable. We can process the resilience together with them. And we are out there to give them hope. Hope of living, hope of even taking care of themselves and even their families. Thank you.
Thank you. I know that people dealing with chronic illness tend to have mental health issues. So that's what many people know. But that we don't discuss that. But what I wanted to ask, what are common emotional reactions that they get, that you know is common for people like I living with chronic illness, and how do you validate their emotions without undermining them or minimizing their pain? How do you talk to someone? Like I personally, when I'm sick, I don't know about others, but I'm usually very emotional. And sometimes I get angry very easily and I cry very easily. So if anyone disturbs me, I can just speak rudely because the pain has triggered something in my mind that makes me think like I don't want anyone. And how do you, can you explain on a professional level if it's normal for them to feel those reactions? Because on my end, I'm not a professional counselor. I'm the person dealing with it. But they tend not to believe what you're having is real. But coming from you, a person who doing it as work, you can make the people, not only my parents, but parents to other or caregivers to other people, know that what they're feeling is actually normal. The same way you can get we call them normal people, they get a cold and they start saying, oh, it's bad. Imagine for those people like how do you also validate them without making like their pain is nothing? Could you please elaborate for us? Yeah.
Thank you so much, Marvel. And my heart goes out to you.
Thank you.
And even as you talk, I could see the expression of those hard emotions of what you have been going through. Yeah. So as a counselor, number one, we accept you the way you are. And whatever you express, whatever you narrate, we just take it like it's the gospel truth. We don't judge you. We accept you for whom you are. Again, we'll also talk to you through a lot of empathy. How has it been for you, Marvel, to have come this far with such a difficult condition? That's what we call empathy. So we don't judge. We accept, we try to understand, and we can as well validate your emotion. Like now, when you say that sometimes you get very angry, that moment when you are that angry, what is happening within you? Yes.
So an example, so we can help the people. Is that like, when you put examples, it's more clear.
Yes.
So let's say, yes, you're a professional counselor, but tell us how you should talk. Let's say I'm your daughter and I'm very sick, I'm in pain. And as I said before, it triggers for me to start getting angry, like don't talk to me, don't do anything. If you do something bad, I get angry, I cry another minute. Now, how would you talk to me as, leave alone your professionalism, as a mother to me who is your daughter who is facing this scenario?
Marvel, can I request something from you?
Yeah.
Can we do a role play here?
Hello?
A role play, right?
Yes, a role play. Yes. I actually wanted to say that. Yeah.
Yes. I am your therapist, Marvel, and of course I have been. For the last few days, how has it been for you in terms of your emotion?
Okay. Right now, I'm having a bad cold. it's going now the 4th week, and my chest is paining, and I'm getting new symptoms here and there, which I can't even tell my mom. And personally, people think because you go to hospitals a lot, you're used to it. You don't get used to such things. And personally, for me to come for this interview, it has taken a lot because I'm not feeling well. And I'm battling a lot. So with the pain, it's triggering the mental health issue. And I have exams, so I'm trying to persevere all this. And at the same time, Friday go see my doctor, because now I wanted, because me, I'm a person who likes challenging myself. So I wanted first to finish my exams. And then I'll go to hospital. But how will you talk to me now? You're on plane, I'm getting angry because of the pain. I'm like, I don't want this. How would you now start talking to me?
Marvel, I can imagine how hard it is for you to be going through that pain, and you are persevering. I can imagine how hard it is. And when this pain comes to you, how do you react to it?
I get very pissed. For me, on my own, I get pissed. Because I don't, even someone who I don't know, when I see them in pain, I'm usually offering them something to take. But first I'm like, have you eaten? Because those painkillers are strong. I don't like seeing anyone in pain. Pain is the one thing that I believe should not be having, especially physical pain. So I try to help others. So when I'm in pain, I get pissed, because now I want to be in peace. Because when you're in pain, you're not in peace. Yeah.
I hear you. I hear you loud and clear. And thank you for expressing yourself. How would you like your family to address you, or to take you at that moment when you are going through that pain and you are persevering a lot? How would you like your family to help you through?
Okay, first of all, I'm speaking on behalf of people with chronic illness.
Yes.
So if I was the parent, I'm trying to put myself in my parents' shoes. But now this time, I've been sick, so I know what it feels like. So on my end, if I happen to see my child, God forbid, gets a sickness like mine, even if she gets angry, I will not take it to heart. Because some things we say, we're just physically in pain. I just want to get it out of our system. We may even insult you, but we don't actually mean it. So you're like, it's fine. You let us breathe, be in peace, say all we want. Tell them if they need anything. Tell them if they'll sleep okay. Tell them all will be well. Hug or something, then they'll feel okay. But don't get angry when they start talking bad. Now you'll be having a conflict on your own. And that is what I tell people. When you see your child is getting sick, and sometimes other people will start crying, other people will be angry, other people won't sleep. People have their own ways of dealing with pain. So we just try to validate them for real, without minimizing the pain, as you said. Because what you go through, you don't know about tomorrow. Yourself maybe go through it. So we shouldn't be quick to judge people. Because I surely believe that what you do unto others will be done unto you. So if you are good to that person, it will come double. If you are bad to that person, it will come double. So we better be mindful of what we say. I don't even tell people to think twice these days. I tell you to think 4 times. And then ask yourself that question in your mind. Have a role play in your mind. If you'll say it, what will be the outcome? You know, because these days people talk without caring about others' feelings.
I hear you,
and
Marvin.
That's how it should not be. And
great.
I have one last question for you.
When
it comes with coping with caregiver stress, even them, they always feel burnout. What can you say that can help them? And what are the healthy boundaries that to set so they don't become overwhelmed? The healthy boundaries, what not to say, what to say, because caregivers need to know that as well.
Sure. Thank you, Matthew. You have put it so well. And even as you talk, you are representing the world outside there who may not even be able to express themselves, and to let the world know how you would like to be taken or how you would like to be addressed and all that. Now to your question, to the caregivers who are taking care of these people who have a challenge. Number one, they should be very careful about the burnout, lest they also be eroded in their emotion. So be careful about the burnout. Set clear boundaries that here I have a child who has a rare condition, and for me, I am the caregiver. I'm also not taking their pain to be my pain. I need to set clear boundaries and not to be enmeshed in the course of that. The self-care. These caregivers to our patient or to those who are going through the overwhelming situation, they need to take on board the self-care. They need to take care of themselves so that they can be able to take care of this challenged person. And our self-care looks like you need to take care of yourself, you eat health, you drink a lot of water, you can listen to music, you can as well go for therapy for the caregivers. Yes.
Okay, now I have the last three on this topic.
Yes.
It's communication strategies.
Yes.
What language should you use to avoid sounding dismissive or pitying? Because you know the difference between sympathy and empathy.
Yes.
We need empathy, not sympathy.
Sure.
And how should you talk, to avoid like you're saying that condition is not there. The people say
Sorry.
there are people who have cancer, or at least you don't have cancer. Or at least you're not dying. But if you really look into it, we need to be ourselves on medication, no stress, all those things. So what language should you avoid? Should you avoid to forgot?
Sure.
Yeah,
I get your question. When it comes to communication, with the caregivers are communicating with the children who are differently abled or who have a rare condition. Number one, what to avoid is things like blaming them, judging them, becoming irrelevant, and even placating, just being there. Just being there. We need to validate our patient's emotion. So validation comes in. Another thing that we need to bring on board is the congruent, the good communication, the honesty, be honest with them, be open with them, and most importantly, empathize with them, because whatever they are facing could be very hard, and sometimes they don't even know how to express themselves. So empathize with them.
And how do you deal? There are moments when chronically ill people don't want to talk. So how do you deal with those moments when they don't want to talk, especially when they are sick? How do you handle it? And how do you handle it?
All right. Sometimes it's good to give them that space to be themselves. However, even that which they are not telling us could be still be communicating to us, because we have the non-verbals and they usually communicate to us. So instead of maybe judging them and blaming them, we can ask them, if I were to help you, Marvel, through one thing, what is it that I can do to you? Yeah.
Okay. And how do you help? The last question.
Yes.
How can I help without making them feel helpless? You see, I'm gonna give an example. Sometimes we do need help, like doing some things.
Yes.
And sometimes you find that we want to ask for help, but at the same time we don't want to seem helpless. So how do you help them without making them feel helpless? Because when I was in high school, I was in year 9.
Yes.
We were like moving the desks and chairs.
Yes.
So I couldn't do that. So one of the teachers, she was an English teacher,
Yes.
and she was like, can you help that girl? She's a weakling. Just do that. She's weak. Just, and
Sorry about
I
that.
found it that time. That's long. It's fine now. That time I was like, I'm not that weak. In my mind, it was really hard. They could have just said, just help Marvin, and that's it. You don't need to add the other sentences. So how can you help them? So they don't feel helpless. Like you can even see your child is suffering to do that, but she doesn't want to seek help, so she doesn't look like she's also helpless. So how do you maneuver with that? How do you cope with that? You help her, but you make it look like she also did it. Oh, sure. You can elaborate for us.
Thank you. Number one, you can normalize the situation. Number two, we need to be sensitive with our people because they could be battling or struggling with something. When it comes to helping such a child who have a rare condition or they are differently abled, you need to go straight to them and ask them, if I were to help you through one thing, what is it? Or how would you like me to help you? Because I may assume what you need is for me to lift this thing, but maybe that's not what you are even looking for.
You ask like, how can I be of help?
Exactly.
Exactly. Yeah, you ask such questions, and you'll be like, hey, she has offered. Let me just take it. Not be like, let me help you. Just ask. And I wanted to ask. I got this from a friend who I can't disclose. She was telling me that she also deals with chronic illness. Like lupus and the rest. So she was telling me that for her, she's also a planner like me. I personally plan my things. What I'll watch in the week, what I'll do in the week, what I'll read in the week, and then I tick the boxes. If I've done 5 things, if I've written 5 things and I've been able to only do 2 things, it's fine. I give myself a tap and say next 2 you can do 3.
Sure.
So she was even saying things like if she's able to finish reading a whole book, doesn't matter if it's soft copy or hard copy, or if she's able to watch a movie during the day. If yesterday she woke up at 12 p.m., today she woke up at 11, it's still a good thing. But to us now, but now when we say it now to our caregivers, they say, you are not doing enough. What can you say to them to make them understand we are not like you? We will never be like you. That's the thing. That it's a very, you're in a different world, I'm in a different world. You can go out for days and still feel good. People like me, I'll go to school and come home like, hey, and what can you tell them to make them understand those small things we do? Okay, them to look, they look small, but people like us, they look gigantic. Anyway, they look so big,
Yes.
Because it's not something we do easily. Like for me, I like in terms of wiping the floor is hard, but in my wardrobe, I arrange the clothes and listen to songs, and I'm like, I've done it. Great. That's what I've done. So how can you explain to them that the things we do, I said they may look small to them, but to us it's a big thing. What can you say to the parents, caregivers?
Sure. I would love to encourage